I spent so much time researching online, looking at loads of different clinics, and I came across this one and it had really good reviews. And I phoned up and the receptionists were really friendly. They booked me in for a consultation with Dr. Strawford, and we spent a lot of time talking about this particular treatment. And then, yeah, within 2 weeks I was booked in.
Fractora is a new treatment. It's a way of fractional resurfacing of the skin to get remodeling of the skin. We're using radio frequency energy, but with Fractora we're using a combination of heads that contain different lengths of needles on to actually fire the energy through the skin to the deeper layers. It can be used for a wide range of conditions such as acne scarring, scarring on the body. It can be used for facial rejuvenation, for tightening skin, for changing skin where there are fine lines and wrinkles, where we're wanting to improve the elasticity and thickness of the skin. So it's a good treatment for younger patients, certainly with acne scarring and other conditions. It's also a treatment that can be very helpful for somebody who's noticing the aging changes of the skin and wanting a better skin, skin width that is smoother, less lines and wrinkles, and tighter. Okay, fabulous. That's all the photos I need. So, you come up on here. So, now what I'm going to do is I've got to get you really anaesthetised, all right? It's going to take about half an hour, a good half an hour. And I want that to be really working, because for me to get the best out of this treatment, I want to use as much power as possible. Any treatment to the skin and the dermis itself is very sensitive. So any treatment where we're clearly doing this, we're going to be causing quite significant pain. So pain is something we have to manage. I now have a system whereby I can give total anesthesia to the face and the skin to make a very effective high-power treatment pretty much pain-free. The principle with Fractora is that the more energy that we can deliver into the skin and below the skin, the better the results and the quicker the results will come. With Fractora, sometimes we need to use more than one treatment. The stronger the power that we're doing with each individual treatment means that often we need to do much less treatments as part of a treatment cycle. So I'm going to just start infiltrating a little bit of this fluid now underneath the skin, all right? Fractora is ideal, as we've said, for use on the face for the conditions I've listed, such as acne scarring and fine lines and wrinkles. But it's very effective also on the body. So I'm often using it where there may be laxity of the skin, and we're wanting to try to tighten the skin and improve laxity, such as around the knees or the inner arms, where there may be some visible lines and laxity. It's certainly very effective in the neck as well, where we're looking to get tightening of the skin in the neck. So really anywhere where we're wanting to achieve a degree of skin tightening and skin remodeling, then Fractora can be an effective treatment. It's also an effective treatment for scars and even stretch marks. I've had some very good cases where we can treat post-pregnancy stretch marks very effectively with Fractora and achieve a very, very nice skin remodeling result and a reduction in the appearance of stretch marks. Fractora is often part of a treatment plan that I offer patients, and it can very commonly be combined with other treatments such as dermal fillers, skin lifting with Silhouette Soft. I use it in combination with face and neck type, where we're using the body type, face type procedures to improve, to get a significant non-surgical facelift. I will often improve the result by combining that with Fractora. I often combine Fractora, especially when we're dealing with scarring and other conditions such where we're wanting a significant remodeling, with PRP or platelet-rich plasma. The growth factors from platelet-rich plasma, when combined with Fractora, can enhance the results and speed up the recovery time following Fractora. When we're doing treatments with Fractora and we're really trying to change the skin where there is significant scarring, such as in acne scarring, then it's unrealistic to expect a full result after one treatment. We usually suggest a treatment course then of around 3 treatments, with about a 4 to 6 week interval between treatments to allow the skin to recover properly between each treatment. With other conditions such as photoaging or general aging of the skin laxity, then we can often just improve things with one treatment if it's high power, and at low power we may do 2 or 3 treatments. When we're doing the high power treatments, we have to fully anaesthetise the face. It does involve quite a lot of injections into the face of anaesthetic to get full anaesthesia, but it does allow us to deliver a very high intensity, powerful treatment to get the best results. Fractora is often compared to other significant resurfacing treatments of the skin. Probably one of the best known is the CO2 laser, which can achieve similar results to Fractora. The problem with using a CO2 laser is you're effectively delivering the energy on the surface of the skin. It does penetrate through the skin to have an effect at the deeper layers, but clearly it has a lot more damage to the outer layers of the skin. The consequence of that is there's usually a lot more downtime, redness, swelling, and time for the skin to heal. With Fractora, because we're delivering the energy deeper down through the use of these heads with pins on or needles on, then there is less damage to the surface of the skin, less trauma to the surface of the skin. So the swelling and the redness settles very much quicker in my experience. Usually within 3 or 4 days, most of the swelling and redness has disappeared, and certainly by a week, most patients are back to normal. So that's the Fractora done. Okay, so you feel very red, very hot, very tight in the skin. Okay, it's quite a significant treatment. What I'm going to do now is put a hyaluronic acid recovery mask on, which helps soothe the skin down, all right, and allows the skin to just start recovering a lot quicker, all right? Okay. When you come for a Fractora treatment, obviously we've had a consultation hopefully beforehand and discussed the indications and reasons for Fractora. But the whole procedure is a comfortable procedure. It's one where you'll be in the clinic for approximately an hour, maybe longer. After we've got full anaesthesia of the face, we'll do the Fractora treatment. But at the end of the Fractora treatment, you will be quite red and the skin may feel a little bit swollen and hot. And so we help the healing process by applying a hydrating mask, a hyaluronic acid mask that's put onto the skin. The skin at that point will absorb all of the hyaluronic acid, which helps to hydrate the skin as well as help the skin recover. We also put you under an LED light system, which actually again reduces inflammation and reaction of the skin and starts the healing process much quicker. So usually by the time you left the clinic, the skin has calmed down quite significantly and you're feeling a lot more comfortable after the treatment. I've been doing Fractora now for a number of years. It's a system that is very popular in the United States of America, where it's become quite mainstream over there as an alternative to the CO2 laser. I think you'll find it will become increasingly popular in Europe and the UK as people see the advantages of using Fractora and the results that we can achieve, as well as the significant reduction in downtime. The other important factor with Fractora is there are different heads that we can use, combinations of different depths of treatment. We can customize it and use coated or uncoated needles to deliver the energy. So we can tailor all of the skin types without risking significant post-inflammatory hyperpigmentation. This is really important in dark skin types because any damage to the skin in a darker skin type can risk post-inflammatory hyperpigmentation, where there are brown marks or patches where you've treated the skin. This is much more common with a CO2 laser and something we can reduce the risk. So certainly it's an excellent treatment for black, Asian and coloured skin where there may be significant scarring and acne scarring?
I didn't know what to expect really, but it was actually quite bearable. I feel quite numb at the moment still, and now it just feels like I have sunburn. I think the redness will take a week or two to go down, but the puffiness will go down in 24 hours. Quite positive actually, because it's quite an aggressive treatment, although I couldn't really feel very much during. I feel like it would really work. I think I'll only need a couple more times. He made me feel really comfortable, and he was telling me what he was going to do the whole way through. So yeah, I feel really comfortable.
We can achieve excellent results. We've achieved excellent results with Fractora, certainly with the ability to use the different heads for the different conditions, and the ability to offer a high power treatment, a very powerful treatment with full anaesthesia has allowed me to achieve some pretty exceptional results when it comes to facial scarring and scar treatments especially.